I'm Dr. JC Hutchins. I'm one of the clinicians at APIA and also the behavioral health supervisor. And I'm just going to be talking a little bit about understanding stigma and how we can prevent it. It is estimated that 23.4% of the US adult population live with a mental illness, and 16% of people ages 12 and older live with a substance use disorder. So it's not uncommon that people are experiencing these issues. And around half of adults with any mental illness and 87.7% of people with substance use disorders did not receive treatment within the past year. So that's a significant portion of individuals who are not being treated for something that is very treatable. And part of that is due to mental health stigma. So in general, mental health and substance use disorders are some of the most stigmatized conditions in our society. We tend to view them differently in compared to physical conditions. So the first type of stigma is personal stigma, and it involves internalized shame that people with mental illness may have about their own condition. This may involve beliefs thinking that one is weak, for example, due to anxiety or depression or trauma. The next type of stigma is public stigma, which involves negative beliefs held by society. It involves hurtful comments as well as rejection. An example of this is thinking that individuals experiencing depression are lazy. We often hear that people say, just snap out of it, pull yourself out of it. But we understand that depression is more complex than that. People may experience a lack of motivation, which can look like laziness on the outside, but really it goes deeper. There's another stigma involving structural stigma that's systemic. It may involve government policies, law enforcement, healthcare that limit opportunities for people with mental illness or provide unjust or unequal treatment. Examples of this would be insurance covering less for a mental health treatment compared to a treatment for a physical condition. Going into the roots of where this is coming from, one part of it is that mental illness generally has a lack of education around it. Many people don't learn about mental illness in school. They don't learn about symptoms. Many people can't recognize the symptoms when they see it. And so there is some misunderstanding in general. Some statements that are pretty common to hear include people with depression are lazy. Everyone feels that way sometimes. Just get over it. A major one that we hear a lot is once an addict, always an addict. And we know from research that that's not true. People can always recover. We can also see that stigma can be traced back to how mental illness is portrayed in media. Sometimes we see that it's portrayed in film, often associated with violence, often extreme cases, or incorrect portrayals of mental illness. There's also cultural norms that contribute to stigma. Many cultures view mental illness as a source of shame or weakness. Of course, there can be a religious aspect of this as well. Some cultures can view mental illness as some sort of possession. Some cultures may view mental illness as a connection to God. So it varies by culture. There's also historical context that is important to pay attention to and how we've treated people with mental illness across our historical context. For example, locking people away in asylums was something that we did for a very long time, where there were often many hurtful treatments involving isolation, bloodletting. And many women, for example, were diagnosed with hysteria when they may be experiencing depression or anxiety. And so throughout history, much of mental illness was treated with fear, secrecy, and with cruelty. And so why is this important? It's because stigma has a big impact on quality of life. For example, the biggest one is limited utilization of treatment. People are less likely to seek treatment and stay in treatment when they have internalized stigmatizing language or beliefs. Stigma can also increase a sense of hopelessness. It can lower self-esteem. It can cause more social isolation, and it can also cause the feeling that there's something wrong with me for experiencing this. And then, of course, public stigma. It results in limiting access to housing or jobs. For example, someone experiencing a mental disorder may find it more difficult to find and sustain jobs. And all of this can result in a lower quality of life. So what can we do about this? One thing that we can do is really talk openly about mental health, not keep it in secrecy. And that's one of the best things we can do to reduce shame, is have open discussions about it. We can also normalize treatment as something like going to a doctor, a primary care doctor, to get a regular checkup, normalizing that people can engage in treatment for mental health and that it does help. And also showing compassion. We know that these are very complex disorders with many sources in our society contributing to it. And so having an understanding of where this is coming from, what the individual is experiencing, can make a big difference. And when we do talk about mental health in general, it's important to pay attention to language that we're actually using. We can use terminology that recognizes that mental health and substance use disorders are treatable conditions. Recovery is possible for everyone. And then person-first language to emphasize humanity. We use language that's neutral, factual, and non-judgmental. And we use language that incorporates there's so many factors contributing to these conditions, and we need to take that into account as well. Some examples of terminology that can be helpful is using substance use or substance use disorder instead of labeling addiction as abuse or a habit. Another example as individual first language is a person with, for example, anxiety disorder, an individual using by injection, a person experiencing a mental health crisis. You can see how this is different from using terminology that really defines and labels a person by these behaviors, such as abuser, addict, junkie user, crazy, or psycho, which many of us have heard throughout our life. And then another suggestion is using substance-free or describing someone as a person in recovery rather than clean or former addict. When we use the word clean, the opposite of that is dirty. We tend to use language that carries a lot of weight, and it has impact on how people view themselves. I guess the takeaway is mental health disorders are common, and isolation can be a result of stigma. Stigma, the language that we use, the negative beliefs can isolate people further. It can result in them feeling alone in their experiences. But education on mental health symptoms, open discussion with compassionate language, and an understanding of where these disorders are coming from can be helpful and can really engage people in treatment. Here are some citations if you're interested in more. There's a lot of research that's developing around the impact of stigma across these 3 different levels, which is really important because we know that treatment helps.